Hi, I'm Kimberly Thompson, and we are doing a demo video for auriculotherapy. This patient came in with bilateral shoulder pain, and she is actually a regular patient of mine. And she will go ahead and tell me what happened with your last treatment.
It's been wonderful for about a year, and suddenly everything just hurts again.
Everything just hurts again. Well, it was perfect timing for you to come in for a video, wasn't it?
Absolutely.
So, both shoulders, tell me about the pain. What's happening?
Worse in the right shoulder right here.
Okay.
But then kind of radiates up on both shoulders.
Okay. All right. So what we're going to do, I've got my shoulder pain protocol pulled up, and I am going to I'll be treating with the Stim Pro this time. So first thing I'm going to do is find the electrically active points, and I'm actually going to bring over the frequencies and have them show. So most of the frequencies for shoulder pain are in the yellow zone and at 10 hertz. So I'm going to just go ahead and have my Stim set at 10 hertz. There's one point in the 20 hertz realm for muscle relaxation. So I'll change over to that. And then for the most part, everything is in yellow. So I'm going to first find the electrically active points. When I find it, I am just going to push the button and treat. I like to treat for about 10 to 15 seconds, and we won't be using needles. Before we start, can you move around and create the pain? Like when I do this is when I feel it.
No, it's just sitting.
Just sitting still?
Yeah.
So if you move your neck or if you look forward. But when you just sitting there, you feel pain.
Yeah.
Okay. I like to ask my patients that ahead of time, because then when I'm done with treatment, I can have them recreate their position and show me how their pain is. So we've got something to compare to. Okay, so we found a point here. When you're treating with the Stim Pro, it would be similar to treating with a probe and finding the tender point, and patients actually recognize the tenderness when you find it and you're treating it. It's a little bit more tender. Are you feeling that a little bit? Okay. All right. I'm treating each point for about 10 to 15 seconds. That's a good one, huh?
Smart.
Yeah, and oftentimes when you find that good one, they feel it a whole lot more, and I like to just hold it. Someday on another video, we might talk about what I actually feel under my fingers. I used to, when you're holding a needle and you actually feel energy releasing, I've gotten to the point with the Stim Pro that I can feel that right through the device as I'm holding this, and I can feel this releasing, and it's not as tender anymore, right? Did it come down a little bit? It's pretty tender still? Okay. All right, and let's move to 20. Find this point, muscle relaxation. Sometimes if you don't feel a point or you're not hearing it, if you go over it a few different times, like notice I'm coming around and around, but then when I narrow into that muscle relaxation point, it actually comes alive, and so we know that needs to be treated, because relaxing is your middle name, right?
Mm-hmm. Absolutely.
So what I'm going to do next, while I treated all those points, again, I left an indentation with the Stim Pro, and I know where I treated. And I am going to take the ear seeds. These are the Vicarious Ear Seeds, and I am going to treat each of these points with the ear seed. And I don't think that the seeds themselves have specific electrical properties. I have heard people say in school that if you just put a seed, it has some type of property. I think that the seed has to do with getting the point, having it in the exact right place. So finding it electrically with the Stim Pro and then putting the seed in the exact right place, that is really what makes all the difference. And are you noticing that when I push on these seeds that they're tender, similar? So here's a little trick. When you're treating the front of the ear, you are treating the tendons, bones, and ligaments, and they are the actual points that show up in your Auriculo 3D. But when you're treating tendinomuscular pain, after you've found the points on the front of the ear, you want to find the matching point on the back of the ear. And that is the muscular portion of the anatomy of that point. So we know that she's got tendons, bones, and ligaments that are tight and out of place, but it's the muscles that are causing that problem. So we need to get the muscles to relax. So when you treat the back of the ear as well as the front of the ear, your treatment is 10 times more effective. And that was a really powerful thing for me to learn in this journey. I like to have a pair of these little what do you call these things? Tweezers. Tweezers handy to pull the seeds off. Are you feeling the tenderness on the back of those ears?
Mm-hmm.
And then I am going to add that point in the center. So even though we were treating with different frequencies on these points when we were using an electrical device, when we're putting the ear seeds, it doesn't matter. And we've put these on, and I have stimulated the points. And then I'm going to have you just kind of sit and feel what's happening in that shoulder. Are you feeling a difference? Mm-hmm. Did the pain go away? Mm-hmm. Are you feeling it any on the right? We didn't treat the right, but I'm just curious.
Not really. It doesn't usually hurt as bad as the right one, though. It does,
oh, right. Exactly. I had my sides mixed up. So when you're just sitting there, are you feeling any more pain in your right shoulder? You're not. That's a high five, yeah? I know.
Job.
So then the most important thing that you do after a treatment like this is you give your patient homework. When we're done with this video, I'm going to go ahead and treat her other ear just to keep things balanced. But what I want her to do, her body is going to try to recreate this pain because it's been in this position for so long. And as she leaves here, the pain is going to try to come back. She now has a tool when she gets home that she can push on these points and relax and move the shoulder around and then have that pain go away immediately. And she can do that over and over and over again over the next couple of days. And that is how you are able to take care of chronic pain conditions. So here's how I explain the homework to my patients. Say, okay, so obviously this feels really tender and it feels like I'm pinching really hard on your ear. I'm really not.
Really?
I'm actually only giving this amount of pressure and I'm not pinching hard at all.
Yeah.
The reason you're feeling this is because these are the active points.
Oh, okay.
And when you touch these ear seeds, they are really powerful on those active points. So I don't want you to go in and dig thinking that I was digging in your ear because I'm not. I am just giving a little bit. And if you'll do that multiple times through the day, and especially when you're feeling the pain, and after you push on them, just kind of move around, move your head around, and you'll find that that pain just goes away.
Okay.
I've had patients who have come back to me 2 weeks later and still had their ear seeds on. I typically would book you for the following week, and I would tell you the day before you come back if you'll take the ear seeds off before you come next time. That way we can find the points that are electrically active again. So when you wash your hair, they will stay. If you take a scrub brush and you scrub your ear, they're not going to stay so well, but they will just stay in the process. And then cool conversation pieces. You can tell all your friends, look, I went and saw my acupuncturist. And I'll give you a card and you can hand it to them.
Absolutely.
Okay?
Too.
All right.
Thank you
Thanks
so
so much.